Thank you for joining. This is our fourth quarterly Screening Saves Navigator Network meeting. So it's hard to believe that this is our fourth one this year. We started this program this year, and we're just really excited to have you on board. So I am going to kick it off to our program manager, Hannah Horowitz, and she's going to give you some data. And for all of you, she is our program lead for this project. And so she's probably been the one emailing you and that you've been hearing from. And if you have questions, you can reach out to her or really Paige and I as well. But Hannah, if you want to get it going.
Yes, so thank you all for coming. I'm so excited to see so many people joining this call. We have quite the packed meeting for you all. So I will just go ahead and start. So the purpose of this survey was basically to understand lung cancer screening practices, challenges, and innovations from navigators across institutions. Our main goals were to identify barriers to screening uptake, inform targeted interventions and policy recommendations, and enhance screening access and adherence. So this is just basically a statement that I put how critical lung cancer navigators are and patient navigators are to the cancer experience and just how all of this insight is going to best inform the Screening Saves program to design more effective interventions and increase the screening rates and improve patient outcomes, which is why we're all here. So the current screening practices. So most all institutions do screening for high-risk populations. So that was at 89%. So most systems focus on screening high-risk individuals using low-dose CT. Targeted outreach and education. So a lot of the outreach programs that raise awareness in at-risk populations that are often focused on community engagement and education. 22% use mobile screening units. I know that's a little bit newer, but it's used to reach the rural or underserved populations, increasing access where traditional healthcare facilities are scarce. And it's not technically always rural, as you guys all know, but just to increase patient access. And then a lot of institutions also use telehealth and virtual care. So systems are integrating virtual care to manage follow-ups for patients with transportation or logistical barriers. All right, so some of the main challenges that were mentioned, staffing shortages, that has always been an ongoing one, limited availability of navigators and support staff, particularly in multi-hospital systems, which leads to difficulties managing patient loads and follow-up care. Next one is that insurance and financial barriers. Medicaid and uninsured patients face the high out-of-pocket costs, and that deters population participant. I think it's about $250 if I'm remembering correctly for out-of-pocket, even if you are on Medicaid. And we just need to kind of talk through how patients are kind of reacting to that, and we'll talk more about it basically, but not just for patients who are on Medicaid. So low patient participation, so education gaps, stigma, and lack of awareness contributing to low screening rates. So that kind of comes with patients coming in for their first screenings, but do they come in for their second screenings the next year, or are they coming in continuously? Just talking about that. The scheduling and coordination issues, so ensuring timely follow-ups, that is remaining a challenge, and many systems are still kind of working to refine patient tracking between visits. A big one that was mentioned was interdepartmental coordination. So collaboration between all the different departments and the navigation teams can often be difficult, and that impacts the patient care. So the next steps and recommendations that were kind of the takeaways from what you all shared in the survey was expand staffing and resources, easier said than done. Strengthen insurance advocacy, so making sure that patients are aware of what their insurance covers, their options for uninsured patients, options for Medicaid patients, all of those things, because I found that sometimes when you bring the more information directly to the patients, they're able to navigate it a lot more. Okay, so let's see. All right, my screen keeps blinking. enhance community engagement, so launch education campaigns to combat stigma and raise awareness about lung cancer screening benefits. Improve patient tracking systems, so kind of sharing best practices for how institutions are tracking what patients are coming in, how many patients are coming in. A big thing is going to be metrics. We want to improve kind of the way that we are tracking numbers across the state. So how many people are getting screened per in a time span, and then how many are getting that follow-up screening. All right, the last one is the multidisciplinary collaboration. So same thing I mentioned before, just making sure all departments are kind of working together and how that has best worked out at your institutions. Just working together across radiology, oncology, and navigation teams. Okay, next one. So overall, the survey was super helpful for us to understand where we currently are at, and just how to best benefit, how our organization can best benefit you all, and how we can kind of use this platform and use the Navigator network as a way to grow together, and ultimately improve those patient outcomes and care. So it was very helpful information. I actually have a kind of a one-pager document that will be sent out at the end that goes a little more in depth. It has all this information, but it kind of is a nice, concise summary of what the survey takeaways were. So I'll be sharing that after the meeting. Lisa will be our speaker today. We are so happy to have her. So Lisa Franks is the lung cancer screening nurse navigator for the WakeMed Lung and Chest Health Team, established in 2018. She has nursing experience of 40 years of service in the medical and surgical cardiothoracic surgery. The last 6 years have been invested in serving specific population of those eligible for lung cancer screenings. All right, so Lisa, take it away whenever you're ready.
Yes, thank you so much for the invitation and the opportunity to join this network meeting. This is my first time attending, so I just have a basic overview of how our program started or how I became involved, and I know among the expanse of participants today that there may be some that are just beginning, or there may be some that are well advanced, but overall. When I began in 2018, if you'll go to the next slide, basically, coming from the cardiothoracic intensive care, I had not really, we had some thoracic patients and we had some lung cancer patients, which were more of a rarity. So I began to look at the ACR registry, or, the ACR sites for information to educate myself. And I felt like this one program structure that I read in the Journal of ACR still stands today. It's very basic, but it helped me to have a foundation and structure that we're looking at who is eligible, as you mentioned, that high risk. How do we educate the patient and the providers to get to the point of ordering the exam and then actually completing the exam? And then once the screen is done, the review. So with the positive findings and the communication to continue that, process that, yes, even if it was negative, it's very important to have it annually. If there is a positive finding, then some of the providers are like, what do we do now? So communication is key. And a big part of my role was to help with the referral networking, and obviously with our team and commitment that we want to improve quality, and the organization is always looking at reimbursement. So, and then the research frontier, being involved with community like this organization for research. So again, just looking at the journey, we already had an ACR registry in 2017. We had a new thoracic surgeon that was very motivated and experienced with thoracic oncology. Having those key physician champions was really the foundation. Having a thoracic surgeon that would get a pulmonologist involved, and so much has been, built on that foundation of that desire and drive to start this program. So the collaboration with our contract at Raleigh Radiology, it just really impresses me how much they are invested in our program as well. So initially we had to get informatics involved. Back in 2018, we had a pretty long project where we created a BPA, the Best Practice Advisory, where there would be an alert that would go to the primary care basically or pulmonologist. There were, certain designated specialties that it would go to, but the BPA fired based on information put into the electronic health record, which we use Epic. And our team built a Healthy Planet registry. So the logics on that registry were in alignment with the medical record, in that if they met the criteria, they would present on this registry. But the BPA did not tend to be as useful as we thought because it's an alert that is often overlooked. And there's a lot of other detail with that I won't go into. But looking at all of the key players in our program, the marketing support, having materials, websites, and then my role was created to be a critical link to kind of help patients navigate and, like I said, from the order to the results and then the referral process. So we really have zoned in on our primary care providers. Initially it was more about what is the correct code so that it will pass, and timing of referral. And it has just been an ongoing process where we continue to maintain open communications with them, offer them AHAC, through our Wake AHAC, offering them CME opportunities in different avenues, and having a primary care advocacy where we can attend their meeting. One of their quarterly meetings, we have the opportunity to to be there and present the specialty service and how we can work together. And that happens in their meeting in the fall. So every year we do look forward to that, having the one-on-one contact with them. So also, we did start out initially running out into the community. So even before I knew what I was doing, I have to admit, before I was really well educated, because of our key thoracic surgeon, she is such a very social networking person. We were already going to the community providers in certain offices that she had established some relationship with, and we were trying to make one-on-one connections where if you do lung screening, we're here in this community, we'd love to help. So I just wanted to share one of the marketing pieces that we used with the focus of, are your patients at risk? And just making more awareness that lung cancer is the leading cause of cancer death in the United States. So we utilize this as for our provider pamphlets, and also it was one created for the patients. And then also just kind of spreading the word or increasing our communication. As we said, communication is key. We adapted the term early on, uh, chess team, so that we can kind of make an impression of, we have a specialty team. We want you to call this number. We have a specialty line. If you have any questions, it doesn't, anyone of any nature can call this 919-350-LUNG. We're there as a resource, and just trying to, have a contact name out there through email or internal Epic in Basket. But a key thing is, as everybody is probably familiar with, a rapid connect, or now it's, for us, is Proficient Health, where you communicate like a beeper to acknowledge a need for a consult or some communication among a team member. So we created the chess team. So therefore, myself and we currently have one thoracic incidental pulmonary nodule navigator. We had two, and one just retired, and some of you on the call may have communicated with Wanda Adams in the past, but we now have Pauline Dela Cruz with us, which is a wonderful advocate, and her experience coming from the emergency room, because a lot of our incidental nodules are, we want to make sure that just a little, I know we're focused on lung screening, but we also want to acknowledge that those that come into our system do not leave. If they came in through the emergency room for some other reason, we don't want them to leave with a nodule finding that is not addressed. So that's a big part of our chest team as well. These physicians are available. They run a call system. So even at nighttime, if an emergency room provider or anyone else is up late, they can, if it's very important and they're worried about it, they can always reach out to one of our providers. They're very accessible. So just briefly, not a lot of detail, but just a reflection of how our lung screening volume has increased. You got to start somewhere. So we are excited that we are increasing along the scale. Majority of our lung screens are ordered by the pulmonary providers, which we're happy for that, and our clinic is growing. But we still have a lot of work to do with the primary care providers. Some, recognize our consistent ones and applaud them that they are on it, but they do need help. And they do need help, more help. And one of the primary focuses that we are working on is that lung screening should be part of the health maintenance topic. I realize they have A to Z from, immunizations and all of the other health maintenance topics that they have to address, which they tend to do in a wellness visit. But we are definitely underserved in that area and want to help support the primary care provider. We do receive a number from non-WakeMed providers to utilize our imaging facility. And along this, it's been a while since I had actually gone to the National Radiology Data Registry, and I thought it would be kind of interesting to mention that for 2023, there are 127 registered in imaging centers in North Carolina, and of those 127 facilities, about majority do greater than 10 exams, but the highest number of screening, the top 5 sites are doing over about 2,000. So kudos to different varieties of I think there's an impact from each one, whether it's small or large, that we're all having an impact. So as mentioned, it's not just getting the patient screened. We want them to come back annually. We have been monitoring our adherence rate. It's been increasing on the average 62 up to 70% of those that return within 11 to 15 months. I did want to kind of compare that nationally, and so I pulled an article from 2020 that is in my references where that article came from. But anyway, it's pretty consistent, showing that 55% adherence rate. So with our action to try to stay on top of the annual reminders, we have an automated letter system that goes out not only to the providers, but to the patient. Like, we'll send a letter to the patient first that you're doing 30 days, and then we begin to help the providers provide that order if they have not been in touch with the patient, or just some monitoring. The letter goes out, but then also as a nurse navigator, I do monitor that. One thing that has helped, I'm not sure if other programs do this, but initially, I did not have a dashboard or a way to know who was getting screened. So we created a work queue for me where I could see all of the orders within WakeMed. And that way, that puts me in a position to be more on the in front of the order advocate, where I can find out, why the patient has not had the screen completed. And I don't know about your facilities, but it's a little discouraging that there's such a time lapse in between the order to when the image is actually completed. I'd like to see the turnaround to be more like 2 to 3 days after they went into their provider's office, but it's more like a nudging that needs to be done or a follow-up. So, action for future success, that EPIC documentation plays a key role of having a reflection of someone that is eligible. So if the substance history is not completed accurately to um, cause that cadence of alerting the physician or coming into our registry, we're underserving those. And unfortunately, sometimes the patient feels that they want to underreport, but sometimes it's just a lack of documentation accuracy. So we want to continue to focus on that. And again, what I mentioned, one of my primary focuses right now is we have a committee with one of our primary care providers who is an advocate and on on not just lung cancer screening, but overall the health maintenance, in that we want to be listed there and have an open forum for where we can have discussion and do what works for the primary care provider at their level and what would be helpful for them to be able to identify the patient on their visits. So this picture was something I discovered early on, and we do care about lung health. We all want everyone to be able to breathe a little easier. And when I re-looked at this picture, I thought, there are some facilities that are doing a large number, but every small facility does their part in helping the patient population that we are here to serve. And that's just a reference of the journals that I had included.
Again, this can be a unmuted, share in the chat, kind of just a discussion amongst ourselves to share what our organizations have been doing. So the first one is a connect to purpose. So share a meaningful story or accomplishment in screenings or care. And I know a lot of people shared those in the survey results, which I really appreciated reading through those. But just go ahead and unmute or whatever best works.
I'll just go ahead and share something that it's just fresh on my mind right now, a meaningful situation where a patient, she's about my age, and she had breast cancer 20 years ago. And when so she had breast cancer and resection and radiation and chemo. And so fortunately, someone continued lung screening for her. I can't remember. Yeah, so I think like a 2-year interval of lung cancer screening for her, and I think that's very important. But she had a scar on the pleural area that was kind of questionable, labeled it as a scar, but they continued to follow it and it grew. And I just remember talking to this patient that she, 20 years prior had gone through all of this treatment, and to find another finding on a screen, her biggest concern was finances. She had to, she was concerned about, she had had some already current finances, I guess debt management with the hospital that she was working to pay back, and she did not want to have the PET scan. So I spent a lot, I'm just grateful that I was able to talk with her several different occasions to convince her that we could help her with finances to have this PET scan. And she just had that area removed, and it was a primary lung cancer, likely caused by radiation. It just concerns me that some patients, the finances are in the forefront of their mind.
Absolutely. And that kind of goes back to the patient education, kind of making it the easiest that we can to bring that information directly to the patients and kind of being upfront with saying, this is the cost, these are your options. And I've noticed that when I worked in navigation, that was also kind of it was the biggest thing. The first question was always, how much is this going to cost me? And I think now more than ever, but totally agree with you.
I'd like, if I don't, I love to chime in on that too, Lisa, is that I'm Lynn from Live Long, and we are an patient advocacy organization. And that is a huge factor. I mean, I know just in Wilmington, we have a patient who contacted me because she could not make her copays. I mean, she even has insurance, and she's like, these copays are killing me, and I make very little money. I have very little income, and what do I do? And it is. And I think that is something that we definitely have to consider when we are screening, is that there's more to this than just discovering that you have lung cancer. It's how are we going to pay for this, and how is this going to impact my family and life? But thank you for bringing that up. I just wanted to say thank you, because that's sadly often overlooked. And I do think that a lot of our patients, they need education on the financial aspects of this. And this is why that financial navigator is so critical. And again, I'm going to use a Wilmington example. This was several years ago, one of our Wilmington patients, she came to one of our meetings and said that she had thousands and thousands and thousands of dollars of credit card debt because she had been putting all of her medical bills on her credit card. And that is because she was not navigated. No one had actually navigated her and educated her on how to handle this. So anyway, I just wanted to chime in and give you my 2 cents, and also to say thank you for acknowledging this. Thank you.
Thank you, Lynn.
Thank you for sharing, Lynn. I agree. A lot of as it was also mentioned in the survey that a lot of the times patients, that not getting screened is kind of part of that. It makes it real almost. It makes the financial implications, the health implications, it makes it very real. And so just fear of that is a big part of it as well. So thank you both for sharing. Does anyone else have a connect to purpose or anything to chime in on the discussion of financial barriers? Just go ahead and unmute yourself.
Just have a question that kind of goes along the lines of an accomplishment. I just wondered if anybody did anything that they thought was very effective on National Lung Cancer Screening Day last month in November. Just curious if anybody did any large efforts and had any success there.
Hey, Paige, everybody. I'm Jennifer Lewis, Outreach Coordinator for ECU Health Cancer Care. And I did not do anything super great for National Lung Cancer Screening Day, but I did get media requests for the Great American Smokeout last month. And I know when I was younger, that was a little bit more heard of. Even the news reporters that came to talk, which they're also young now, they really didn't know what it was. And so I was able to talk with them about that. But I got the opportunity on the day before the Great American Smokeout to speak on behalf of ECU Health Cancer Care on all 3 of our local networks, TV networks here. And I am not gonna lie, I kind of like turned the conversation to lung cancer screening on every single one of them. And so, because that's really what I've been wanting to do. And Lisa, I agree with you. I got to meet you, I think, at the stakeholder meeting, but really getting in front of the PCPs. But so I used all 3 of those. One was a live interview that morning, and then 2 folks came to my office, and I was able to talk about the importance of lung cancer screening. And the station out of Newbern, WCTI, they used their whole story to talk about lung cancer screening. And so that was kind of a win. And it was funny because the next day, I don't know if it was coincidence, but the next day I scheduled 4 patients. So one of the providers in a county north of us reached out. He had 3 referrals that next day. And then I got several phone calls from viewers asking questions, not really even realizing that they may need to be screened for lung cancer. So I felt like that was a really big win, and I'm looking forward to, especially on the heels of our stakeholder meeting that we had that was so great last month. I'm looking forward to really kicking off 2025 with a renewed emphasis on, like Lisa said, making those one by one connections with PCPs and letting them know what we're doing here at the medical center for patients, in hopes of getting them screened. So
That's wonderful, though, the media exposure. That was great.
mhm.
And I think you raised another accomplishment, I would say, would be the stakeholders meeting. There was a statewide meeting held last month during Lung Cancer Awareness Month that the Early Detection Subcommittee for the A4C group, so the State Cancer Control Branch, the State Cancer Plan, that group, just tried to pull together as many folks from across the state as possible to talk. And we largely talked about screening. And I think it was just a great way to bring people together, as you said, Jennifer, and to just kind of kick off discussions on what we could do collaboratively next year. So it's really good.
Hey, this is Morgan. Can you hear me? Can you hear me?
Yes.
Yes.
Well, I'm the nurse navigator for lung screening at Novant Health in Winston-Salem, and we had a great experience with Lung Cancer Screening Day. We decided that we would have the day, both the Friday and the Saturday, because our imaging center was only open a half a day on the actual Lung Cancer Screening Day. So we started about 2 months in advance to get ready, and we were told by our radiology departments that our imaging, that we didn't have to worry about anything, that they would take care of scheduling the patients. Well, about 2 weeks before the event, before the days, they only had 11 patients scheduled. And of course, if 11 patients are scheduled, not all of them are going to come. So I work with a coordinator who follows up with patients, and she went to our dashboard and she just dove in and pulled up the names of people who were due, like either in October or December, somebody that we could fit in the framework and look for orders. And she scheduled so many. I think she scheduled 18 or 20 imagings, and so for our first lung cancer screening day, we actually had 30 completed. So that was at this one site. So that was a real accomplishment, I think. And really, I credit the Denise's efforts on making that a huge success. Someone who actually called the patients and didn't ask them actually to be screened on that day, just told them they were due, and then offered them the days that we were screening, and enough of them, took those days, and we had a great turnout.
That is so awesome. Thank you for sharing. Let me see in the chat here. Where did my chat go? My chat disappeared. Well, we had some really good messages in the chat. One of our navigators mentioned that they had a patient who was diagnosed at stage 1, essentially fell out of care due, I think it was due to financial implications, and then had to go back into care, went back into care at stage 4. So that was just interesting to share. Oh, here's my chat. Okay. Yes, lost her insurance and never went back for care. And now she is back getting her treatment started. Another person mentioned that Duke does have CT appointments on the weekends throughout the year, but on the 9th, they opened up telemedicine appointments, so they were able to see a few patients on Saturday, November 9th, for Lung Cancer Screening Awareness Day. We have someone else here saying at Wake Forest, at Atrium Health Wake Forest Baptist, we were lucky enough to have screening available in the early mornings between 8 and late evenings after 5 routinely. Oh, that's fantastic. In addition to some Saturdays throughout the year, this is so beneficial to those who work daytime hours to not miss work. Agree completely. With that, I am going to move on to the next thing. I would love if everyone, just because I'm looking at time here, what I would love if everyone could drop in the chat, common educational challenges that patients face. So it can be just kind of one word, a phrase, but what is the common gap in education? And I guarantee it will probably be most of the same ones, but just go ahead and drop in the chat what that common gap is in education. Need for follow-up scans, exactly. And how often? Yep. One and done. Yep. Needing scans for symptoms versus screening, even educating some primary care providers, EDs, completely. That lung screening is a thing. Wow. Feel free to keep dropping those in the chat. But the last question is just future goals. So if anyone wants to share kind of your main organization's goals for 2025 in terms to navigation, screening, and then someone else said educating primary care physicians and helping them get insurance approval. But if anyone would like to share 2025 goals, just because it is the last meeting of 2024, would love to hear those. For the gaps in education, so another one is medical terms that the patient understands. Completely agree. Increase referrals from primary care providers. And then some goals for 2025, promoting screening to primary care providers and increasing those numbers. Yes, exactly. Getting into the community to expand lung screening. Oh, lung screening and educating more primary care physicians. Exactly. Continuing to reach those eligible and not being screened within our system. Expanding our program to begin tracking incidental nodules in 2025. Fantastic. These are all great things. Thank you all for sharing. So with that, if anyone would like to say anything else, I'm going to go ahead and move into closing, but would like to thank everybody for coming today. And I really appreciate everybody sharing. So let's just go ahead and see. There you are. And then Paige, would you like to give some closing remarks?
Sure. Well, first off, I'm so happy to see all of you on the call. And so this is our fourth call for this year, and we are planning for next year. And so the first thing I'll say to you all is we were able to hear from 4 different, very diverse programs this year in our calls. And so we want to build out programming next year that really meets your needs. Again, the survey data that Hannah shared was very helpful. These discussion points are helpful. But please let us know if there's topics and things that you want to learn about. And then also let us know if you have a screening program or aspects of your program that you think would be of interest to this group, because we want to hear from as many different programs as possible. So we are still looking at how to highlight so many of you and what you're doing. So please reach out to us, reach out to Hannah, and let us know, if you have something to share for next year, or if you have topics, that you really want to know more about. And as Hannah said, we're trying to build out additional spaces for you all to connect. We want this to be your space. And we're also looking at ways to involve more of you in the planning, of our content for you all throughout the year. So the other thing I'll say, Hannah, when you were asking us to share accomplishments, one thing I'm super pumped about right now is I just came back from the National Lung Cancer Roundtable, and some of you were there, and I was so excited to see you there. But it was so exciting to see what other hospitals are doing, what other states are doing, other organizations around screening. And there's a lot that we can learn from here in North Carolina. So I'm really excited about, seeing how we can learn from, other roundtables, other Navigator network groups, and other statewide efforts. And so, I just think there's a lot of opportunity for us to continue looking at how we can partner to make a difference. The other piece there, the challenge that, we've talked about on these calls, is the data. How can we look at our screening rates and see how we're helping to move the needle. And so that's something else that we would love for input from you all. And we have other partners that we're talking to about, where can we get data that can really help us look at, the screening trends and, even some of the data that we captured in our survey with you all. We hope to be able to survey you again at the end of next year and see if we've been able to make some positive changes and impact each of your programs. So anyway, this is for you. This is your space, and we would love your involvement and your input as we continue to grow our Navigator network. But with that, I hope you all have a wonderful holiday, and we'll look forward to seeing you all next year in the new year.